Let's talk about fatty liver disease. You've probably heard the name, but you might think, oh, that's something that happens to heavy drinkers when they get old. But what if I told you that is becoming one of the most common causes of liver disease in the world? It is affecting people in their 30s, 40s, and even children. And the scariest part, you can have it for years and feel completely fine. Look, this study published in 2020, for example, shows that there is an increasing risk of fatty liver disease in the pediatric population, with about 70% showing fibrosis and 15 to 30% showing advanced fibrosis. Let's just pause here for a moment. Fibrosis is actually the second worst stage of fatty liver disease progression, meaning that many kids already had scarring and some had advanced damage. So, what exactly is fatty liver disease? Let's for a moment ditch the complex medical jargon and imagine that your liver is a sophisticated processing plant. Its job is to filter everything you eat and drink. Now imagine that plant's storage rooms start filling up with a bunch of nonsense, and in this case, fat. Well, a little bit of fat is normal. In fact, your liver is a normal fat storing and processing organ in your body. But when more than 5% to 10% of your liver's weight becomes fat, that's when we call it fatty liver disease. Now, this is crucial. There are two main types of fatty liver disease: the alcoholic fatty liver disease and the non-alcoholic fatty liver disease. And the second one is the one that can affect anyone, even if they don't drink a drop of alcohol. And for the sake of this video, we will keep using the term fatty liver disease to refer to the non-alcoholic type. According to a 2023 study, fatty liver disease affects up to 25% of the global population. That's 1 in 4 people. So what causes fatty liver disease? It's closely linked to our modern diet and lifestyles, like too much sugar, especially fructose from sweetened beverage like soda, high consumption of unhealthy fats, particularly saturated and trans fats found in foods like bacon, butter, and fries, excess calories from ultra-processed foods such as cookies, brownies, and fast foods, and too many refined carbohydrates, including white rice and other refined grains. And obviously, not enough physical activity to burn down all these accumulated fats. Besides these lifestyle related causes, if you have conditions like obesity, type 2 diabetes, and high cholesterol, you are more susceptible to develop fatty liver disease. But why should you care at all? A little fat in your liver, is that a big deal? Well, remember we said that when more than 5 to 10% of your liver's weight becomes fat, then there is a risk of fatty liver disease. Well, that fat sitting in your liver, if not taken care of, can start irritating, then inflame the liver cells. This is when simple fatty liver progresses to something more serious called hepatitis and or NASH. And if that inflammation isn't controlled over the years, it can lead to scarring, known as fibrosis, and later to cirrhosis, a point where the damage becomes permanent and can lead to liver failure or even liver cancer. The journey from liver, fatty liver to cirrhosis can be slow and silent, and that's what makes it dangerous. So now you are probably wondering, what are the symptoms, what you should look for? And this is the tricky part. In the early stages, there are often no symptom at all. None. Nada. Often it's discovered by accident. Maybe your doctor notices that your liver enzymes like ALT and AST are slightly elevated on a routine blood test, or an ultrasound for another reason picks up a bright or fatty liver. And as it gets more advanced, you might feel persistent fatigue, malaise, and mild abdominal discomfort. And while doing my research, I also found that some people mention sugar and carb cravings at the early stage of fatty liver disease, although that has not been scientifically proven. So if this got you thinking, please talk to your doctor about it and get your blood work done. A single marker may not indicate early fatty liver disease, and further large-scale studies may be needed to better understand what's going on. But at least you will have awareness and have the power to take control of your liver health. Now, the good news is that the liver is an incredibly resilient organ that can regenerate and heal itself. In the early stages, fatty liver disease is almost always reversible. How? It is not with magic pill. It, it comes down to simple, consistent lifestyle changes. And I like to summarize this using a simple framework called RESET. R is for reduce sugar and excess fat. E stands for engage in physical activities. S is for support the liver. E is for eat real whole food. And T stands for time your meals. In the next video, we will break down each part of reset and show you exactly how the steps improve your liver health and help you reverse fatty liver disease. If you found this helpful, please give this video a thumbs up and subscribe for more real talk about the science behind your health. I will see you in the next one. Thanks for watching.